Hello, my name is Dr. Linda McIver and I run the Australian Data Science Education Institute. We are a charity dedicated to helping kids understand data. Today I want to look at how the death rate for a virus like COVID-19 is calculated and why it's surprisingly complicated, and you shouldn't believe everything you read. In epidemiology, which is the study of diseases, the term for death rate is case fatality rate, or number of deaths per case of the disease. But there is no single case fatality rate for any disease because it can vary by age, by health, considering existing conditions and nutrition, etc., sometimes even by season or existing immunity, available healthcare, and many other factors. We have quite well understood death rates for viruses like the measles that have been around for a long, long time because historical data is really a lot easier to process than the rapidly changing data in the middle of a pandemic. Even so, the case fatality rate for measles is a range from 0.05% to as high as 6% or even 15% in some cases, which is another reason why you don't want to mess with the measles. You really, really need to vaccinate. So there are two key questions to consider when trying to figure out the case fatality rate. Step one, where do I get reliable data? Now, reputable sources of data are key, and there is a lot of misinformation around about COVID-19. In general, sources like the World Health Organization and government data sites are best, although you do need to check on the date of the data on each particular page or graph, because sometimes they're updated regularly and sometimes they're not. When using third-party sites like ourworldindata.org, you want to check that they're open and clear about where their data comes from. It's one of the reasons I like that site so much, because they make it very clear where they get their information. And the other problem is the number of deaths from COVID-19 keeps changing, so it's not surprising there are differences. But just to make a point, I'd like to show you something Bob Panoff from Shodor.org showed me many years ago. We're going to Google the boiling point of radium. Bear with me, this is relevant. I'm going to flip to recording my screen. Okay, now we're going to Google the boiling point of radium. Now, radium is a well-known element. It's been around for a long time. You would think that the boiling point was something fairly concrete and easy to agree on. But if we look at the first page of values, the first page of results on Google, 1737 degrees Celsius. The next value we have, boiling point of radium, 1500 degrees Celsius. The next one, 1140 degrees Celsius. 1737. 1737. Okay, so if you scroll down, you can see that there are a whole lot of different values. Down here, we have a boiling point of 1140 degrees Celsius. So there are a whole bunch of different values just on the first page of results for the boiling point of radium. So now I think I've made my point about the reliability of information on the internet. Thanks to Bob Panoff for showing me that one. Okay, so one of the results that I've seen has been that the deaths are currently around 14,687. And this page is also saying that there is a 12% death rate. Actually, nope, it's changed and now it's saying 13%. Naturally, this is scaring the pants off people. Now, the death rate for coronavirus is indeed scary, but it is nowhere near 13% on any reasonable measure. Now, when we're calculating the case fatality rate for a virus, one of the things we actually need to do is define the death rate. Now, that might seem to be a simple thing. Number of dead divided by the number of infected times 100 to give you the percentage. Except there are a bunch of problems with this calculation. Number one, COVID-19 is spreading so rapidly that the number of infected is changing incredibly rapidly. Number two, we don't know the number infected. In particular, people who have it but don't show symptoms are impossible to detect unless we test everyone, and people with mild symptoms might never show up either. So the number infected is likely much higher than any number that we actually have. The death rate also depends on treatment availability. So in Italy, where the number of cases has massively overwhelmed the health system, the death rate has been much higher than in other places like South Korea, where the health system has not been overwhelmed and everyone's been able to get treatment. And this is where it gets really tricky. Number four, because COVID-19 is spreading so fast, the number infected today is much bigger than the number infected was yesterday. But the death rate is mostly from people who got it weeks ago. So we really want to be able to kind of freeze the data and compare the people infected on day X with the people who were infected on day X and then died. We don't have any way to do this. We simply don't have that data. So any death rate that we're doing is highly speculative. In addition, some countries are doing very little testing. It's impossible to know the true death rate as we really don't know how many people are infected. In South Korea, where the testing rate was comparatively high, the death rate has been recorded at under 1%. And again, they had a really good health system and they controlled the spread of the virus, so their hospital system wasn't overwhelmed. They did so much testing that they know pretty accurately how much people were infected, including asymptomatic cases, but still, they only tested 5,200 people per million inhabitants. So we've got a very nice sample size, but it's not complete. By contrast, the US has done 74 tests per million, so they have no idea how many people are infected or what their death rate actually is. So anyone who tells you that they know the death rate for COVID-19 is either lying or deluded. All we know for sure is that the lowest rate we've seen so far is just under 1%, which means the case fatality rate is significantly higher than the flu and it's a lot more contagious. So the only option we currently have for lowering the death rate is to slow the spread of the virus, and that means staying home and having as little social contact as possible. That's brutally difficult for extroverts like me who run on hugs, but it's all we have to fight this virus with. This has been another Data Science Explainer from Australian Data Science Education Institute. If you like it, please share it and donate to help us make more at givenow.com.au/adsei. Thanks, and see you for the next video.